Hello, my name is Adrian Zoller, here with David Blauer and Eric Roseman to represent Bjönd. First, we would like to show an expanded version of our 90-second video that puts the innovative power of Bjönd Health into a patient-centered perspective. After this short video, we'll go into more detail about the potential clinical and commercial impact of Bjönd Health.
Let's talk about two numbers, 5 and 50. The first number, 5, that's 5% of your covered lives, the sickest 5% to be exact. They're the ones driving that second number, 50. That's 50% of your medical costs. Of course, this isn't a new problem, and the fact that chronic illness is the culprit certainly isn't news to you. Healthcare organizations like yours invest millions trying to control the cost of that 5%, and it hasn't been easy. Care management systems are supposed to help, but they do little more than capture data. Then what? In the United States alone, we lose $400 billion annually because these systems have been unable to effectively and efficiently control chronic illness amongst the sickest few. Well, let's start taking that $400 billion back. Introducing Bjönd Health. Bjönd Health has workflow automation, decision support, and behavior change software that improves patients' lives and recovers millions in lost ROI. And it does it all without replacing your current care management system. So how does it work? To find out, let's meet Mike Shaw. Mike is a 54-year-old diabetic with CHF, hypertension, obesity, and depression. He's smack dab in the middle of that 5%. But Mike isn't just a number. He's a unique person for whom only personalized, dynamic care can make a lasting impact. He has a wife and 2 kids and works hard to support them. He gets by okay in most years, but this year's been rough because of his health issues. He's used up his sick days, so he no longer takes time for preventative checkups and ignores health problems that would keep most people home. So while his situation may seem dire on the surface, he's actually one of millions of treatable, chronically ill Americans with many reasons to get healthy and stay healthy. If we can motivate Mike to take preemptive steps towards better health, he and his family will enjoy a better quality of life, and you'll see a big difference in your bottom line. It's one thing to know about Mike, and another thing to know what he needs to do to get his health on track. But it's an entirely different thing to get him to do it at all. Luckily for Mike, his health insurer, Axo Blue Cross Blue Shield, uses Bjönd Health to supercharge its care management practice. After consuming data from hundreds of different sources and analyzing it in the cloud, Bjönd Health tagged Mike as someone fated to drive high medical costs, but ready and able to respond to intervention. Bjönd Health's discovery prompts Axo's care management system to assign Mike to a care manager named Nancy Smith. Nancy reviews Mike's record in Axo's system as usual, but relies on Bjönd Health to manage his care. Based on Mike's medical, psychosocial, and life management needs, Bjönd Health pulls from its library of evidence-based workflows and workflows authored by Axo and Mike's providers to build a hyper-personalized care plan that addresses Mike's unique situation. Bjönd Health's stunning interface enables Nancy to easily understand and interact with Mike's care plan. She can even edit it knowing that Bjönd Health will prevent her from making any change that would diminish its integrity or endanger Mike's well-being. Once activated, Mike's care plan starts delivering workflow automation, decision support, and remarkable outcomes for Mike and his care team, not to mention big, measurable savings for Axo. Bjönd Health distills Mike's care plan into a series of manageable goals, each with specific tasks that drive him to overcome barriers and reach success. Some tasks are just for Mike, while others are for members of his care team, family members, social supporters, healthcare providers, insurers, and other stakeholders in Mike's health. But Bjönd Health tasks are far more than mundane to-do items. With Bjönd Health, tasks are rich workspaces with all of the interactive functionality, information, and incentives needed to get Mike and his team to actually do them, efficiently, successfully, and consistently. Bjönd Health can send tasks via any channel according to users' preferences, so tasks arrive when, how, and where they will be most productive. Mike prefers to get his tasks through text messages. When he opens them, he has immediate access to context-sensitive information and tools he needs to complete them efficiently. In fact, every task in Mike's care plan enables real-time collaboration, uses just-in-time data from outside systems, and provides exactly the right mix of tools for empowering its recipients to complete it without having to use other applications. Tasks even enable crowdsourcing via functionality for proving task completion and consummating payments. But all these cool features are meaningless if Mike doesn't actually change his lifestyle. A key to Beyond Health's success is behavioral economics. That's our ability to understand and determine each patient's core motivators. Guilt, social aspiration, fear, and material reward are among the many powerful motivators that drive human behavior. And using Mike's individual mix of them is what will drive him to make real, lasting change. In Mike's case, Beyond Health discovered that material reward and family responsibilities motivate him most, so his newest task uses both to drive completion. But tasks aren't only for Mike. In fact, his local supermarket recently received a Beyond Health task to pick and pack healthy groceries for his weekly meal plan. Meanwhile, biometrics from Mike's last task caused Beyond Health to send a task to Kristen, a physician's assistant at Mike's PCP. Kristen believes that Mike's congestive heart failure caused his sudden weight gain. In just seconds, Beyond Health helps her search its library to find and propose the best intervention. She sends her proposal to Dr. Williams, Mike's cardiologist. Dr. Williams is making hospital rounds with tablet in hand when she receives Kristen's review request via an email from Beyond Health. Beyond Health with its EMR integration allowed Dr. Williams to open her task, review Mike's situation, and e-prescribe Lasix in minutes. Earlier, Beyond Health notified Mike's wife Sheila about Mike's groceries being ready. Sheila is already at the supermarket when Beyond Health texts her another task about picking up Mike's Lasix at the in-store pharmacy, now just 2 aisles away. Sheila grabs Mike's prescription, checks out, and marks both tasks as completed. Done and done. So what just happened here? By building and automating Mike's care plan and empowering everyone on his care team, Beyond Health saved AXA $1,247 today and set Mike on the path to save them over $80,000 this year alone. And Beyond Health's clinical efficacy and the 5-fold productivity boost that it delivers to care managers and providers are the powerful 1-2 punch that will ripple and multiply through AXO to create $300 million in additional annual savings across thousands of others like Mike. But more importantly, it provided Mike and his family with something priceless: his health and their well-being. And that's just Mike, one of the risky people who otherwise would have relentlessly caused most of healthcare's costs and inflated everyone's health insurance premiums. There are millions of Mike Shaws out there. With the direction and productivity gains that Beyond Health provides, we can reach them all and start moving them out of the risky 5% and into longer, healthier lives. In the end, these aren't the numbers we want to focus on, because the only number that matters to Mike and his family are the number of happy and productive years that they get to spend together, which translates into another number you care about: a healthier bottom line.
As you can see from this video, Beyond Health allows healthcare organizations to reach the right patients with the right care at the right time by providing a seamlessly coordinated experience that increases efficiency while decreasing both administrative and clinical costs. Chronic illness is the driving force behind the recent escalation of healthcare costs. Of the $3 trillion the U.S. spends on healthcare each year, 75% is spent caring for chronic illnesses like diabetes, obesity, and heart disease. More than 50% of U.S. adults have at least one chronic condition, and this trend is only increasing as Americans continue to live longer, resulting in a growing burden for patients, their families and caregivers, and the healthcare system. Care management can help patients with chronic illnesses improve their quality of life and control the cost of their conditions. Large payers each spend between $60 and $230 million annually to employ 500 to 2,000 preventative care workers. However, these workers must log into and interact with at least 5 and as many as 7 different software systems to complete just one patient encounter, severely limiting their efficiency. Currently, payers are only able to provide care management for less than 3% of their members, while more than 35% would benefit from these services. Clearly, care management cannot realize its promise without unprecedented technology. Beyond Health dramatically improves the efficiency of care management by bringing together data from these disparate systems and reducing the time required to engage in each meaningful patient interaction, allowing care managers to reach more patients who need help. Beyond Health has been meticulously designed based on years of market feedback gathered by our CEO. Dave, can you elaborate on this?
I founded my last company called Click for Care As CEO for 10 years, I grew Click4Care to over 140 people and a $150 million valuation. I was Click4Care's sole employee for its first year, and during its first several years, I designed every click in its flagship software, did all selling, and wore many other hats. I closed 24 customers for Click4Care, including United Health Group, Cigna, the United Kingdom's National Health Service, CVS Caremark, the Principal Financial Group, the Italian federal government, Tufts Health Plan in Boston, and several large Blue Cross and Blue Shield companies. Such contracts constituted over $100 million in revenues, and their pursuit included my visiting nearly every major health insurance company and at-risk healthcare provider. Those interactions became the foundation for Bjönd Health, and many of our key features were designed in direct response to requests that I heard from care managers at these companies. Bjönd Health can be fully integrated with existing care management systems, electronic medical record systems, and other relevant pieces of software, so our customers can realize the full value of Bjönd Health without undergoing costly and time-consuming system replacements. This easy integration enables Bjönd Health to dynamically update patients' care plans based on all relevant inputs to drive a continuous cycle of data-driven care. Because Bjönd Health is cloud-native software as a service, users can access it securely via browsers or as a native application on any mobile device, all without any installation or physical implementation.
Our system will enable payers and providers to identify patients who need help before their health conditions worsen. Bjönd Health care plans allow for unprecedented personalization that will drive compliance as each patient sees exactly what they need when they need it. These care plans are based on standardized, evidence-based interventions that will reduce errors and allow for clinical efficacy analysis to further refine and improve them. Bjönd Health automates many of the burdensome administrative tasks that make care management so inefficient today. Automating just 5 of the simplest of care managers' many tasks will save an average of 13.8 minutes per task. For a typical 3 million member health plan, this translates to savings of over $50 million per year. The market for Bjönd Health is $3.3 billion in annual software as a service subscription fees, plus $1.8 billion in related service fees, for a total market size of over $5 billion per year. When Bjönd Health version 1.0 becomes generally available in October, early adopter customers can expect to see productivity gains of 30 to 50%. Bjönd Health tasks can be sent directly to patients or to any digitally enabled stakeholder that the patient designates as their proxy, activating the patient's entire support network. And each task includes rewards based on behavioral economics that will drive real behavior change. Eric Roseman, President and Chief Creative Officer, can tell you more about Bjönd Health's innovative user interface.
Bjönd Health's user experience is based upon extensive interaction with hundreds of nurses and care managers who represent the typical prospective users of the application. Unlike existing care management systems, Bjönd Health is designed from the ground up to be as intuitive and ergonomic as possible. Bjönd Health's user interface enables users with minimal technical skills to graphically create rich interactive assessments, construct elaborate care plans, and build complex scoring, branching, tagging, reporting, and routing rules using conditional logic by dragging and dropping rather than typing. Bjönd Health tasks embed all content and tools necessary for completing them and deliver them to patients and all members of their care team in a seamless and delightful consumer-oriented experience. Bjönd Health's usability will provide an incredibly powerful yet immensely captivating platform, leading to increased efficiency and patient engagement.
Bjönd Health is a truly innovative solution that addresses all the complex facets of a growing and costly problem. Our workflow automation, decision support, and behavior change software can deliver $200 to $500 million of EBITDA for large customers. Bjönd Health is built on decoupled, future-resistant technology and offered as software as a service to a huge and growing market of needy customers. Bjönd is led by a team of experienced experts in healthcare technology, user interface design, and software development, and has already attracted an A round of venture capital funding. In conclusion, Bjönd Health enables healthcare payers and providers to give the right patients the right care at the right time, saving millions in administrative and medical costs while improving engagement and quality of life for millions of patients. Thank you for the opportunity to present, and we welcome any questions you may have.